In case of ectopic pregnancy, the fertilization can take place over here in the tubes. There are 3 classical signs of ectopic pregnancy. In many cases, it can be prevented, such as pelvic inflammatory diseases, in tuberculosis, by treating the infections before they cause severe damage to the tubes. The term ectopic pregnancy refers to pregnancy that occurs outside the uterine cavity lining. It is a medical emergency that affects about 1 to 2% of all pregnancies, and there has been a gradual increase in its incidence. Now I'll try to explain the ectopic pregnancy with the help of this diagram. So this is the normal uterine wall lining. Normal pregnancy takes place over here. But in case of ectopic pregnancy, the fertilization can take place over here in the tubes. These are the tubes, or in the ovary, or even in the cervix, or somewhere outside of the uterus. Now, since these pregnancies are not well supported by a musculature of the uterus, it may rupture in some time, which can lead to excessive bleeding inside the abdomen and also bleeding inside the uterine cavity, which comes out through the vagina. This is hence a medical emergency. The woman, in case of such bleeding, can become severely pale with feeble pulses and can lead to shock. Hence, in such cases, medical intervention immediately is absolutely necessary. In very early pregnancy, the signs and symptoms of an ectopic pregnancy are almost the same as that of any normal pregnancy, such as nausea, vomiting, fatigue, and breast discomfort. There are 3 classical signs of ectopic pregnancy: history of missed periods, pain in the lower abdomen, and early pregnancy bleeding through the vagina. If a pregnant woman becomes severely pale, the pulse becomes feeble, which can be checked like this, and if she faints, then these are the signs of shock, and the woman requires immediate medical attention. Let me now tell you what are the possible causes of ectopic pregnancy, because if you know them, you can prevent it. Pelvic inflammatory disease means infections that affect the uterus or the tubes. For example, certain STDs like chlamydia infection. Tuberculosis, which affects the fallopian tubes and distorts their anatomy. That still consists of many cases in the Indian scenario. IVF itself increases the risk. A history of infertility is associated with ectopic pregnancy. Previous tubal or pelvic surgery also increases the risk. A history of ectopic pregnancy in the past will also increase the risk. Multiple abortions in the past are linked to ectopic pregnancy. Smoking itself is very detrimental to your fertility, and the risk of ectopic pregnancy and other fertility problems drastically increase if you smoke more than 10 cigarettes per day. Increasing age at the time of pregnancy, especially if the age is more than 35 years, has adverse pregnancy outcomes. And certain genetic causes are also linked to the development of ectopic pregnancy. So if you think you are pregnant and the urine pregnancy test comes out to be positive and you do not decide this pregnancy, then do not take an over-the-counter MTP kit right away without confirming that the pregnancy is inside the uterus or outside of it. If it turns out to be ectopic, it can have serious consequences. So, before planning termination, always consult a gynecologist. So, can ectopic pregnancy be prevented? Yes, in many cases, it can be prevented, such as pelvic inflammatory diseases, in tuberculosis, by treating the infections before they cause severe damage to the tubes. It can also be prevented by using contraception. Seeking treatment early is beneficial as it provides the woman an option of managing the condition medically, and it prevents any complication that may arise in long-standing cases. In the next video, I'll be talking about the management options for ectopic pregnancy.